Hi, I want to welcome you all here today. My name's Jared Armshaw. I'm going to give you a speech on how to properly wrap an ankle. What I want you to do is picture this scenario. You're hiking with your best friend in the woods when all of a sudden he rolls his ankle. He's pretty sure it's not broken, but he can't bear weight on it. Do you leave him to go get help? It's almost dark and it gets cold. How do you find him again? Or, if you simply have an ace bandage, you can wrap your friend's ankle and maybe save his life. So today we're going to talk about how to identify an ankle injury, how to wrap it correctly, and how to treat it. For identification of this injury, we look for two main things: bruising and swelling. Bruising is simply a discoloration of the skin. It could be red or blue, depending on how old it is. Swelling is a defense mechanism of the body sending more fluid to the region that has experienced trauma. Your ankle is structured by three main ligaments and three main bones. These ligaments are your talus, posterior and anterior, and your calcaneus, which is also called the Achilles tendon. Depending on the injury, they form, according to Dr. Douglas, from inside out. So that meaning that your calcaneus tendon will get injured first, and then you'll go anterior posterior. Now that we've covered the identification of this, let's move on to how to wrap it. I'm going to ask Kaylin to come up here as my test dummy. Wrapping an ankle is extremely important. You want to make sure that it's not too tight or too loose. So, you approach this ankle from the side, giving good support, because you don't want to hurt your patient. You're going to take the ace bandage and wrap it around the ankle twice, like so. And then we're going to go over and around the foot twice. She has small feet, and this is a big bandage, so if you have a smaller one, it might work better. Once we have it like this, we're just going to go in and back down until you have no more bandage. So, a lot of these bandages come with these lovely clips which you use to tie off this bandage. If you don't have them, tape works just as well. Okay, you do the two-finger test to make sure it's not too tight or too loose. If it's too tight, you can cut off circulation, which is bad. If it's too loose, it's just like a sock. Now that we have it, we can thank Kaylin for being here. And I'll talk about how to treat this injury. A good, safe method to treat this injury is to follow this mnemonic device called RICE, which stands for resting, icing, compression, elevation. Resting is so you don't cause any more trauma to the region. And you want to ice it to alleviate some of the swelling. Swelling is good, but if it's too much, it can restrict your blood vessels in your leg, which then will be counterintuitive with less nutrients getting to the region. Compression counters swelling by keeping the ankle compressed, and it adds support. By compressing the ankle, you get better blood flow. And elevation, you want to keep the region above your heart. By having it above your heart, you will have less blood flow. I just talked about how you want blood flow, but for this case, too much is too bad. So, hiking is not the only way to injure your ankle. It's extremely common sport injury, but you can also injure yourself shopping. By stepping off those curbs incorrectly, carrying too many groceries, you never know. So, let's go for a quick recap of what we learned today. We've learned how to identify, how to wrap, and how to treat by following RICE. I want to thank you all for being here and have a phenomenal evening. Thank you.